Hey everyone, I'm Dr. Rezaian, a rheumatologist, and welcome back to the channel. Today we're diving into Uloric, also known by its generic name febuxostat, a medication used to treat chronic gout. Quick reminder, this video is for education and inspiration only. It's not medical advice. Always check with a healthcare provider and trusted sources. So, what is Uloric? It's a xanthine oxidase inhibitor, meaning it lowers the production of uric acid in the body. It's typically prescribed when patients can't tolerate allopurinol or haven't had success with it. Unlike allopurinol, Uloric isn't a purine analog, which makes it a good option for people with hypersensitivity or mild kidney issues. The usual starting dose is 40 milligrams once daily. After 2 weeks, if uric acid levels are still high, we may increase it to 80 milligrams daily. The goal is to maintain uric acid under 6 milligrams per deciliter, ideally under 5 milligrams per deciliter in people with tophaceous gout. Now, here's a heads up. Starting Uloric can actually trigger a gout flare. That's why I always use a prevention strategy. Here's what I do. I prescribe colchicine 0.6 milligrams once or twice daily, depending on kidney function, and prednisone 20 to 40 milligrams daily. I start both 2 days before Uloric. Then I start Uloric on day 3. I continue colchicine for 1 to 3 months. Prednisone is stopped after 5 days. This staggered approach helps stabilize uric acid levels. It reduces the risk of a painful flare when starting the drug. If a flare still happens after starting Uloric, we don't stop the medication. Instead, we manage the flare with prednisone 40 milligrams daily or indomethacin for 3 to 5 days. Stopping Uloric during a flare is a common and counterproductive mistake. Stay the course. Let's talk about the big concern, cardiovascular risk. In 2019, the FDA added a black box warning after studies showed a higher rate of heart-related death with Uloric compared to allopurinol. We're still not sure exactly why, but caution is definitely needed, especially in patients with known cardiovascular disease. That's where shared decision-making comes in. For patients without heart disease and who can't take allopurinol, Uloric remains a reasonable option. Common side effects include elevated liver enzymes, rash, nausea, joint pain, and rarely serious hypersensitivity reactions. Liver function tests should be monitored periodically, and if a patient experiences chest pain or shortness of breath, Uloric should be stopped immediately and evaluated. So when do we choose Uloric over allopurinol? Here's the quick breakdown. Allopurinol is first line, especially for patients with cardiovascular conditions. Uloric is second line, used when allopurinol isn't tolerated or doesn't bring uric acid down enough, even at the highest dose. It may also be better tolerated in people with mild to moderate kidney impairment. In summary, Uloric is a powerful urate-lowering option with distinct pros and cons. When monitored carefully, it can play a key role in managing gout, especially when allopurinol isn't a fit. If you found this helpful, hit that like button, subscribe, and leave your questions or experiences below, whether you're a patient or a provider. Until next time, stay healthy and informed.